Breaking news just a few moments ago from the folks at the REM, the electric rail that we've been waiting for a long time. It's been delayed many times. Now the target is summer of 2023. We are now in the summer of 2023. And we just got word just a few moments ago from the people at the REM that on Wednesday, in 2 days, they will start the dry run, the final stage before the REM launches, where you can go and ride it, where they take the REM and put people on it. So the final stage before the actual launch will begin on Wednesday for the portion of the REM that goes between Brossard and Central Station. So, we've been saying for a while, is this ever going to happen? Looks like we are getting closer. As of Wednesday, the final stage before the real launch, the dry run, begins. This just coming in from the REM. Okay, let's turn our attention now to 911 calls and what happens when it's a 911 call that doesn't necessarily require police intervention. So Montreal is considering some new plans for 911 calls, plans that are designed to take the pressure off of Montreal police officers. A new unit for non-crime related 911 calls is the plan. A pilot project will see calls that are non-violent, non-crime, and purely mental health related diverted to another unit. But there's still a lot of work that needs to be done before the project is launched. Let's find out all about it. Alain Vaillancourt is the head of public security on the executive committee for the City of Montreal. Alain, welcome back to the show.
Hi, Elias. Pleasure to be here.
So why don't you tell us, for the calls that 911 gets, do we have numbers as to what percentage of calls to 911 are crime urgent versus things like mental health issues?
It's hard to get an exact number, but the numbers we have, from the police officers and from Mr. Daguerre, the police chief, they estimate at between 50 and 70% of their calls have mental health related issues. Now, whether they're crime related or not, so it's hard to say, but it's a high percentage of calls that 911 have a mental health issue involved currently. So it's quite large. And when you look at other cities who have done actual independent studies, it's about the same number. So, across the board, a lot of calls that go through the emergency 911 services, whether Montreal or otherwise, a high percentage is related to mental health issues.
So what do we do about it? What are you and the people in charge deciding to do on this one?
Well, the idea is to try and find an effective way to have, when someone calls 911, first is to properly screen the call. If it's a mental health issue with, no other issues as far as violence or crime-related issues, to have that call diverted to a unit with people who specialize in mental health issues, take that call and respond directly without it going through necessarily the SPVM or the police channels. But before we get there, like you mentioned, there's a lot of groundwork to be done. The first thing we have to ensure is that there's a unit available to take the call that's reliable, that's there 24 hours, 7 days a week. That the calls don't always come between 9 to 5. So that's the first thing that we have to ensure. And we're doing so with our IMIS project. The IMIS is a group of social workers or intervenants sociaux that are now in 4 boroughs that answer to mental health issues alongside the SPVM. So, to give you an example, the 3 teams over the last 2 years responded to over 10,000 calls that had mental health issues accompanied by the police. So we're already, having quite a bit of an impact with that, but we have to make sure that unit is available to answer their calls effectively. So that's where we're at now. We also have to find a good protocol when you call 911 that the proper, that the protocol is that the call is screened properly to the unit. So we're working on that with 911. Works PVM, and the community groups also to help us out with some of the units that we'll be putting in this across the city, because the goal is to have in this in the 19 boroughs within the next couple of years.
What about funding of this? Is this does this come out of just the police budget, or does this require even more funding?
Well, the funding for IMIS, the city's putting $5 million a year currently for the next 5 years. We got funding of $5 million a year from the provincial government for the EMIS. So we have $10 million a year for the next 5 years for the EMIS to put into the 19 boroughs. All the other work is being done by our services as far as meetings with 911, developing proper protocol. The SPVM is helping us out also. And part of the funding that we're also increasing a lot of the funding as part of prevention overall across all community groups, so they have longer funding over a longer period of time with more social workers, street workers, etc.
So let me ask you this. Do you think long term, if so many of the calls to 911 don't necessarily require the police, do you think long term the majority, you'll have enough units that aren't police-based units? They're not police officers per se. It's social workers or other squads.
It's hard to say. I think the goal. It's important to have a good structure in place before, and that's why we're working towards the pilot project. Mm-hmm. It'll give us an idea of how many calls coming in. Is it effective in responding to them on in certain boroughs, whatever. But the goal is really so that these calls take up a lot of time for the police. A mental health issue related call. The EMIS right now, the statistics is that it's between an hour and 3 hours of their time when they go on such a call. So already they'll go with the police. If they determine there's no violence or crime-related activity, the police disengage themselves and leave, and the EMIS team stays with them. So we already have, somewhat of a resemblance of what it could look like. And the EMIS team, their goal is to make sure that the person gets into a second-line service. We can't do it alone. We have to make sure that the whole chain is involved. The EMIS team or the SPVM can't do it by themselves. So we're working with public health, with all the CUSs, to get on board, which they are, as far as discussion goes, so that when the people respond, they're taking in charge. A good example I can give you is we already have what we call ICANUPS, which is a psychiatrist-related team with the CUS, along with the SPVM, that will respond to mental health issue calls already. And their statistics show that a person who calls 911 who is taken in charge by this team usually repeatedly calls 911. Well, we show that the people in charge of this, that are under the care of this team, no longer call 911. So already, rely on the team follow-ups in the healthcare system. So we need to go there. The pilot project will kind of take the same resemblance, but we have to make sure that everything's in place before we go ahead with it.
Alain, before I let you go here, I have it on good authority that you're in Mont Tremblant right now. You were supposed to run the triathlon, the Ironman, that was canceled because of the smoke yesterday. Is that correct?
Yeah, I guess you spoke to Jimmy. I was there this weekend. I was supposed to do the half Ironman yesterday. But I was registered for both. I was registered for the Saturday race, which is a shorter distance, and the half Ironman on Sunday. I was able to do the Saturday race, and then Sunday, when we were on the start line, they decided to cancel the race. So we came home. We came home last night. It was a disappointment, but it's the right call. We can't. It's people's health. It was just there was no way you could. We had a hard time walking to our cars with our bikes, so there was no way you could run the race. But there were people there from Japan, California, trained for the whole year to be there. So it's disappointment, but it was a good call by the race organizers. Well, we'll be back.
Yeah, and Alain, I guess that now it makes sense just how buff you are. Now it all comes together. You do these Ironman competitions.
Older, I got to stay active.
Alain, great talking to you. Thanks so much.
Thanks, Elias. Bye.
That's Alain Vaillancourt. He's head of public security on Montreal's executive committee.